Hi, this is Dr. Fox, and let's talk about the larynx. In this video, we'll discuss the laryngoskeleton, or the major cartilaginous elements of it, and how they function within the larynx. We'll also discuss the major intrinsic laryngeal muscles, their innervation and how they work, and we'll talk a little bit about the intrinsic laryngeal membranes and their features. So first off, what is the larynx? The larynx, or colloquially the voice box, is the proximal part of the dedicated respiratory tract. It's contiguous with the laryngopharynx, so air is going to be able to move between the laryngopharynx and the larynx to facilitate respiration. The larynx is going to hang or be suspended inferiorly from the hyoid bone, which we can see here. And it's supported by the thyrohyoid membrane, which attaches the thyroid cartilage of the larynx to the hyoid bone. The larynx is also proximal to the trachea, which is a pathway that air travels between the conductive portions of the airway, servicing the lungs, and the larynx. And it's supported by a cricotracheal ligament between the cricoid cartilage of the larynx and the trachea. So at least these names like cricotrachea and thyrohyoid make sense with respect to what they're connecting. The larynx is anterior of the cervical vertebrae C4 to about C6. And obviously there can be some variation. It may be somewhat higher or somewhat lower in different individuals. Now, the laryngoskeleton is a series of hyaline cartilage elements that give structure to the larynx. So there are several major elements and some minor elements here. We're going to try to stick to the greatest hits here. So we have a right lateral view here and a posterior view over here. And so let's start with the largest laryngeal cartilage, and that would be the thyroid cartilage. The thyroid cartilage is suspended from the hyoid bone, and it sits atop and articulates with the cricoid cartilage. There's also, when we look from the posterior, epiglottic cartilage. The epiglottic cartilage articulates with the thyroid cartilage. And sitting atop the cricoid cartilage, arytenoid cartilages, which are rather pyramidal in shape. The arytenoid cartilages are some of the most kinetic cartilages in the larynx. There are also several other minor cartilages like corniculate cartilages, which sit atop the arytenoids, and cuneiform cartilages, which sit in this airy epiglottic fold, which we'll see later. So let's discuss some of the major features of the laryngoskeleton. And I've color-coded the various cartilages here. So thyroid cartilage is blue, cricoid yellow, epiglottic cartilage is red, and the arytenoid cartilages are green. So let's start with the thyroid cartilage. The major substance of the thyroid cartilage are the two laminae. So laminae are sheets or plates, and these two come together along the anterior midline of the larynx, the superior portion of which is known as the laryngeal prominence. This laryngeal prominence is colloquially known as the Adam's apple, and it may be more robust in individuals with higher levels of circulating testosterone. There are also superior horns. These superior horns are nearest to the hyoid bone, and there are inferior horns. And the inferior horns are going to participate in the cricothyroid joint, which is controlled by the cricothyroid muscles, as we'll see. The Epiglottic cartilage has a stem and a leaf to it. It sits superiorly in the larynx, and the superiormost portion of that leaf is above the plane of the hyoid bone. Just anterior to it are the epiglottic valleculae. The thyroid cartilage is sitting atop the cricoid cartilage, which we can see here. Cricoid cartilage is named after the Greek krikios, which means ring, and it is the only cartilaginous element of the laryngoskeleton that is continuous all the way around the airway. So we have it in the front, on the sides, and in the posterior, and it's really in the posterior where it is most robust. You can see there. The arytenoid cartilages sit atop the cricoid laminae. These are going to have a couple of processes associated with them. So looking at this superior view, that's the thyroid cartilage, that's the cricoid cartilage. The arytenoid cartilage is indicated here as green. There is a vocal process which connects between the thyroid cartilage via a vocal ligament. This is going to be the basis for the vocal cord. So it will be invested by mucosa and known as the vocal fold. And there's also a muscular process here that several of the intrinsic laryngeal muscles will attach to. Now, what this allows for is movement of the arytenoid cartilages either gliding inward so that they can adduct, or outward so that they can abduct, or they can pivot. And when they pivot, they can rotate that vocal process outward so they can abduct the vocal fold, or they can pivot it inward to adduct the vocal folds, as we'll see. So those are the most kinetic elements of the laryngoskeleton. So looking at this in greater detail, here we can have the arytenoid cartilage sitting atop the cricoid laminae. Here we have the arytenoid cartilage from above. We can see the vocal process and the vocal ligament, and then the muscular process. And here we can see some of the arytenoid muscles connecting those together. The greater demonstration here is the difference between the vocal ligaments abducted or abducted, and look what happens then to the rima glottis, the space between those vocal ligaments. It increases in size, or we can adduct them or bring them together here where that space decreases in size. So we can control not just the movement of air through the larynx, but we can also bring these vocal ligaments into contact with that air so that they may vibrate for phonation. Let's take a look at some of the intrinsic laryngeal muscles, not all of them, but some of them, and what they do to the larynx. So let's start with the posterior cricoarytenoid muscles. These are my absolute most favorite muscles. I am most grateful for these. These arise from the posterior of the cricoid laminae, and they attach to the muscular process of the arytenoid cartilage. So posterior crico, and then arytenoid muscles. When they contract, they're going to pivot the arytenoid cartilages laterally so that we abduct the vocal ligaments. So this opens our airway, it opens the rima glottis, that space between the vocal folds, and it allows for maximum ventilation or movement of air through the larynx. These muscles, like nearly all but one set of intrinsic laryngeal muscles, are innervated by the recurrent laryngeal nerves. Now let's take a look at the arytenoid muscles. So the arytenoid muscles get their name because they run between the arytenoid cartilages. So I'll just circle these for you so that we can not be distracted by any of the fluff. So there's two parts to the arytenoid muscles. There are the transverse arytenoid muscles and the oblique arytenoid muscles. These names reflect the directions of their muscle fibers. So for instance, the transverse arytenoid muscles have fibers that run transversely, and these are deeper than the oblique muscles, which cross. These transverse arytenoid muscles are going to glide the arytenoid cartilages together to adduct the vocal ligaments, to bring them in line with the air that's being expelled, so as to promote phonation. So phonation occurs when air is leaving the lungs, passing through the larynx and vibrating the vocal folds. We also have oblique arytenoid muscles. We can see those fibers running obliquely or crossing over like so. These oblique arytenoid muscles will also adduct the arytenoid cartilages, but they also have the added benefit of acting as a sphincter for the laryngeal inlet. So they can narrow that even more when they contract. And both sets of these muscles are controlled by the recurrent laryngeal nerves. Next we have the thyroarytenoid muscles. So thyroid cartilage, arytenoid cartilages. These are muscles that run between the thyroid cartilage and the arytenoid cartilages. So when they contract, they are going to pull the arytenoid cartilages slightly forward toward the thyroid cartilage. What this does is it decreases the tension on the vocal ligaments, thereby lowering pitch. So the higher the tension, the greater the pitch. The lower the tension, the lower the pitch. There are specialized fibers of these vocalis muscles that very finely attach to the vocal ligaments. And if you can imagine a vocal ligament in cross-section like this, we have these vocalis fibers, sometimes considered separate muscles, but these are definitely part of thyroarytenoid muscles. And when they pull, they change the shape of the vocal ligament. Changing the shape of the vocal ligament is going to affect timbre, or the tonal quality of sound as it vibrates the vocal fold. They also, by pulling on the vocal ligament, increase tension, so they finally will raise pitch. And these thyroarytenoid muscles are controlled by the recurrent laryngeal nerves. Now we have our oddball intrinsic laryngeal muscle, the cricothyroid muscle. The cricothyroid muscle is going to affect the cricothyroid joint. And what happens here is when this muscle fires, the thyroid cartilage tips forward. When the thyroid cartilage tips forward, the vocal ligaments are stretched. This increases the tension and also increases the pitch. So cricothyroid muscles increase pitch. Cricothyroid muscles are the exception to the recurrent laryngeal muscles being innervated by the recurrent laryngeal nerves, as the cricothyroid muscles are uniquely innervated by the external branches of the superior laryngeal nerves. Now let's turn our attention to some of the intrinsic laryngeal membranes, of which there are two. We have the quadrangular membranes superiorly and the conus elasticus inferiorly. Now what you're looking at here is a posterior view of a larynx which has been opened up. So it has been cut along the midline and reflected outward so that we may see the inside. Now the quadrangular membranes have two parts to them of interest. There are the aryepiglottic ligaments. These aryepiglottic ligaments run between the arytenoid cartilages and the epiglottic cartilage. And then the vestibular ligament, which runs between the arytenoid cartilage, let's outline that here, and the thyroid cartilage. So there's the vestibular ligament. The vestibular ligament is also known as the false vocal cord or fold. The false vocal folds do not vibrate during phonation, and they are the superior folds within the larynx, so they're the ones that you would encounter first. They can vibrate, however, so if you've ever heard of throat singing, which is practiced by many different indigenous peoples in Asia and some in North America as well, they will vibrate those folds so it sounds like oh. It's higher in the larynx, and there are some fantastic types of music that are produced by this in various genres. So definitely check out throat singing on YouTube or your favorite host site. Now the conus elasticus, which is more distal or further down in the larynx, has a couple of important features. There are the vocal ligaments. Those are forming the basis for the vocal cords. Those are of the conus elasticus. And then there's also the median and lateral cricothyroid ligaments. So there's the median cricothyroid and some of the lateral cricothyroid ligaments there. It's that median cricothyroid ligament which is incised when we do a cricothyrotomy, as we'll see shortly. Now, between the vestibular ligament, which is the inferior most extent of the quadrangular membrane, and the vocal ligament, which is the superior most extent of the conus elasticus, we have a space. This is a more complicated space than we can see here, but this is called the laryngeal ventricle. So that's giving separation between the vestibular folds and the vocal folds. Now, we mentioned a cricothyrotomy in the previous slide. That is the incision of the skin superior to and the median cricothyroid ligament. And then it's cannulated so as to preserve the airway. This is done in case of emergency when there is some obstruction to the airway that's proximal to this median cricothyroid ligament. There are very good landmarks for finding it, so you can palpate your laryngeal prominence and go inferior to it. You can also palpate your cricoid cartilage and go superior to that, and you should feel a divot between the two. That divot is where one would incise and then cannulate so as to provide an emergent airway. There are no vascular issues, so none of the vessels that are an issue for a tracheostomy, which would be here, such as those inferior thyroid veins, if they're present, or the thyroid ima artery, if it is present, that would promote a risk of bleeding. So this is the area where you can perform a cricothyrotomy, sometimes just rather unempathetically referred to as a cric procedure. So that leads us to our assessment question of the video, and that is, which muscles responsible for abducting the vocal folds open the airway? Is it the arytenoid muscles? Well, the arytenoid muscles, they adduct the folds, so that is not the case. The cricothyroid muscles. Cricothyroid muscles tip the thyroid cartilage forward to elevate pitch, so that's not it. Posterior cricoarytenoid muscles. Yep, those abduct the arytenoid cartilages. They pivot them, abducting the vocal folds. Wide open airway for ventilation. That's a good one. Thyroarytenoid pull the arytenoid cartilages forward to lower pitch, so that's the wrong answer. So the correct answer is posterior cricoarytenoid muscles. Thank you so much for your time, and I'll talk to you in the next video.